Today's topic is signs of appendicitis. The signs means what we observed from the patient. The first sign we have to observe in appendicitis patient is McBurney's sign. So in McBurney's sign, that is observed in McBurney's point, it is the point or junction of lateral 1/3 and middle 2/3 of the line joining from the umbilicus to the right anterior superior iliac spine. In this picture, you can see that there is an imaginary line from the umbilicus to the anterior superior iliac spine. So that point is known as the McBurney's point. A positive McBurney sign is when significant pain is elicited by palpating this area in the right lower quadrant. That indicates appendicitis. So when we are palpating the McBurney's point, the patient will feel the pain. That indicates the patient have appendicitis. The next sign of appendicitis is Rovsing sign. Rovsing sign means a positive Rovsing sign is when there is tenderness in the right lower quadrant when palpating the left lower quadrant. That is known as the Rovsing sign. When we are palpating the left lower quadrant, the patient have the pain on the right lower quadrant. That is known as the Rovsing sign positive. Next one is rebound tenderness. Rebound tenderness is when there is brief worsening of pain after releasing pressure while palpating. This indicates possible peritonitis. That means a ruptured appendicitis that leads to peritonitis. So when we are observing rebound tenderness, that indicates the patient ruptured the appendix. So that leads to peritonitis. So rebound tenderness means when there is brief worsening or the pain will be increased after releasing pressure while palpating. If you suddenly release the pressure while palpating, that leads to pain. That is known as the rebound tenderness. Next sign is guarding sign. Guarding is when the abdominal muscles tense up when palpating. This sign indicates peritonitis. Okay, while when we are palpating the abdomen, there will be contraction of the abdominal wall muscle. And this contraction during palpation, that leads to the pain. That is known as the abdominal guarding. And this guarding indicates peritonitis or the ruptured appendicitis. Is Soya sign. Here the patient lies on left side. Examiner extends patient right thigh. Pain is exerted while passive extension of the right thigh. That is known as the Soya sign. So Soya sign is nothing but when the patient is on lies left side, examiner extends the patient right thigh. This extension that cause pain to the patient. Soya's sign can be elicited by another method. Here, the patient is lying in supine position and placing hand just above the knee Ask the patient to lift right leg against resistance of the hand. And when the patient is trying to lift the right thigh or right leg, that cause pain to the patient due to the friction of the psoas muscle over the inflamed appendix. So, psoas sign, it can be done in two methods. First method, patient lie on left side. Another method in supine position. While in supine position, the examiner hand should be placed above the knee and ask the patient to lift the right leg against the examiner resistance of the hand. And when the patient is trying to lift right leg, that cause friction of the psoas muscle due to the inflamed appendix. This sign is known as the psoas sign. Next sign is obturator sign. The obturator sign, here pain on passive internal rotation of the flexed thigh. Examiner moves lower leg laterally while applying resistance to the lateral side of the knee, resulting in internal rotation of the femur. Obturator sign means pain will be occur due to the passive internal rotation of the flexed thigh. And during this sign, the examiner moves the lower leg laterally while applying resistance to the lateral side of the knee. That results in internal rotation of the femur, and this causes the pain to the patient. This is known as the obturator sign. So the main signs of appendicitis include McBurney sign, Rossing sign, rebound tenderness, guarding, psoas sign, obturator sign. Thank you.